It is 5 o'clock on a Thursday, which means that Kentucky restaurants can open in about 7 hours. But it's that time we get together every day, or Monday through Friday, as we're going to talk about the weekend schedule here in a little bit, just to remember and recommit to defeating this 1 in every 100-year pandemic. So let's start the way we always start, by saying and knowing that we're going to get through this, and we're going to get through this together. So say it with me. We're going to get through this. We're going to get through it together. And one last time, we're going to get through this. We're going to get through this together. We're going to get through this together because just like healthy at home, we are going to be healthy at work in a way where we do this better than just about anybody else out there. Here are some of just the very top steps that need to become, again, part of our muscle memory every day to make sure that our workplace can mitigate the risk of this virus spreading and that employees can be safe, as can customers that come in. So let's just mention the sanitizer, hand wash stations today. Any workplace ought to have a significant number of these, many more than existed before. If it's just the same number of bathrooms, that means we're not doing enough. Let's make sure, given that this is an area where right now people can get these materials, our distillers have done so much as far as hand sanitizer, that we are taking advantage of it. We have seen that washing your hands, that sanitizing them significantly, along with these other things, can really reduce the likelihood of the spread of the virus. Let's make sure that we do it. So in addition to these steps, we always talk about that one extra step, fill out your census. We are stuck at 13. And I will tell you that I think it's Utah that's right behind us that is threatening to overtake us. Let's not let that happen. Now let's continue to fill out our census. Again, just 1 or 2% of Kentuckians going online, spending a couple minutes, and filling out this census can make a major difference. A number of 6-class cities in Louisville are actually in the top 10 in the country at cities filling out this census. Oldham County and Spencer County, I think, are in the top 20 of counties in the nation that have filled out the census. But let's make sure that all of us are doing our part to make sure we get the federal dollars that we are entitled to. So in addition to remembering that we're going to get through it, to reminding ourselves of the steps that we need to be taking and filling out our census, especially now that we're going to be healthy at work, that we are transitioning back to reopening our economy, restarting and wanting to do more as we move forward. It's really important that we all do our part. And we show how we do our part by filling up social media with these hashtags, including some new ones people are using about wearing masks. Let's look at what we have today. All right, so yesterday and in a video I talked about why I wear my mask. And I asked other people to talk about it publicly too. You know, to me it was protecting my family, it was living my faith, about treating my neighbor as myself. So Dwight talks about his wife and his daughter in this picture being the reason that he wears a mask every day. This is something that we need to do. It's not comfortable, it's not enjoyable, but it protects the people around us. So I'd ask everybody else out there, again, let's start living this. Let's start showing other people what values are we living by our willingness to wear a mask. Fill it up on social media. Oh, I love this one. So this is an individual proving that it is never too late to get your high school diploma. Now, before COVID-19 hit, this was an area that we were really picking up, offering the free GED tests. This is an individual that's gone back and gotten his diploma. We're going to be talking more and more about the future as we start moving into healthy at work and having the real opportunity. And I know it sounds strange to have an opportunity, but when you've paused an economy and you look forward to what we can help build, not just rebuild, but build, it gives us opportunity here in Kentucky to be more resilient, the next time we face one of these, and to make sure we're truly focusing on the jobs of the future and the jobs that, as we've seen, we didn't have enough in the United States. Let's make sure that we have PPE manufacturers in the U.S. if this comes about again, and that we are not in the same place we were just a couple of months ago. And Virginia, these are two friends using sign language, ASL, to talk to each other in Danville, Kentucky. They have not seen each other in far too long, but again, you are teaching people how you can communicate with that extra social distance, and we appreciate it. All right, so this is the city of Covington, which is getting out there again and talking about the steps, the positive steps to take towards recovery. Everything we did to flatten the curve thus far, everything we need to do moving forward relies on the people of Kentucky coming together and really voluntarily knowing the steps that need to be taken and where we need to go. It's getting people to buy in and to know that all of us have to do our part to make this work. Right. And this is the donation of masks that continue. All around Kentucky, we see people using their days and using their nights to create something just like this to protect the people around them. Now, for those that can't afford it, there are people out there handing them out that know that this is a way to protect each other and our communities. And you may disagree with me for different reasons, but look at Crystal and Savannah and what they're doing. Wear it for them. And here's Habitat for Humanity, a group known for their compassion that's lived by that value for so long, showing it every night for our victims of COVID-19. Continue to light those homes, those businesses, those nonprofits up green. It shows that we are all in this truly together, and we're going to get through it together. So today, we're going to repeat a little bit of sign language we learned. It's about being prepared for tomorrow when we can get together with groups of 10 and under. If you think about it, we've been going through this 2 months and a little bit more, our first case in early March. But since then, we have not been able to get together, even with those groups. So we really want to do it safely. So yesterday, we started talking about a way to remember some of the major things to do, and that is hands, face, and space. All right, so we're going to learn it again. We're ready? Hands, right, face, and the mask, right, and space. One last time. Hands, face, and space. And so if we remember those as we move into this Memorial Day weekend, if we remember we got to wash our hands and we shouldn't be touching each other. If you remember to when you're in close proximity, wear the mask and don't touch your face. If you remember, stay those 6 feet apart even when you've got people together. Your gathering will be safer. None of us want this first time we can get together in this way to be a time when we spread the virus. So let's just take those steps that we know work. All right, today's numbers continue showing a plateau of cases. Continues to be an elevated number of deaths. I'm going to ask Dr. Stack to talk about that because what we're seeing around the country is you see your number of cases go down, but your number of deaths peak a little bit later than that. But we do think, not that there is ever a bright side to losing Kentuckians, but it does suggest, just like we're seeing the infection rate going down, that we are moving in the right direction, that we may be more than just plateaued. We may be in true reduction in what we're seeing about the spread. Now, that may change a little because we have more contacts, because we're going back to being healthy at work. But where we are now compared to where we were even 3 weeks ago is a much better place. So today we're reporting 135 new cases of COVID-19, one of the smallest numbers in a while. And that is out of a Total number of tests of 166,240. That's up over 7,500, I believe, from yesterday. Our number ever hospitalized in Kentucky, 2,041. Currently in the hospital, 475. Ever in the ICU, 886. Currently 92. And recovered, 3,008. That's about a 36% rate of the total number of people who have had the virus. Our total number of cases after our daily audit is 8,286. 111 of those are probable, and the rest are lab confirmed. Now let's talk about our numbers and where we're getting them now. We've been able to make a shift that should make our numbers, including the ICU number, more accurate. We've gone from numbers reported to the EPIs based on the calls that they made to a daily report coming directly from the hospitals that they directly input. So both the number currently in the ICU of 92 and currently hospitalized 475 is from direct inputs from hospitals across Kentucky today. We feel that that is us moving in a direction where all states have had to take these new steps, but should give us more accurate numbers and should give us more accurate numbers daily. Now, it's all dependent on people entering the information. And at the time that they enter the information, just like the rest of it, we are the compiler of this data, but that tells you how we're getting it now as opposed to how we were getting it days or even a week ago. Today we continue to see more deaths than we were, say, last week. We were reporting 10 new deaths due to COVID-19. Those are 10 individuals whose families and whose communities are going to be hurting. It means we've lost 40. At least we've reported 40 in the last 3 days. So it's been a tough 3 days. Dr. Stacks can explain kind of how it happens this way. But let's remember that the green lights, the bells at 10 a.m. are just as important now as when we started them. And we can't get tired of doing especially this piece, of letting other people know that we care about them. So the 10 individuals that we're reporting today include a 93-year-old female from Jackson, a 69-year-old male from Jefferson, a 62-year-old male from Fayette, a 56-year-old female from Warren, a 73-year-old female from Adair, an 81-year-old male from Oldham, an 86-year-old female from Oldham, a 72-year-old male from Simpson, a 78-year-old male from Jefferson, and a separate 56-year-old female from Warren. So again, 10 individuals, 10 more than we want to lose. Let's make sure we're thinking about them and their families tonight. As far as the new cases that are out there that we reported today, of the 135, 23 are from Jefferson County, 18 from Kenton, 15 from Warren, 9 from Boone and Grayson, 7 from Fayette and Logan, 4 from Campbell, 3 from Davis and Shelby, 2 from Carlisle, Carroll, Clark, Franklin, Hardin, Henderson, and Ohio, and 1 from Adair, Allen, Bath, Bourbon, Bullitt, Butler, Callaway, Edmondson, Fulton, Garrett, Hopkins, Jackson, Lincoln, Livingston, McLean, Metcalf, Monroe, Nelson, Oldham, Pendleton, Pulaski, Taylor, and Tremble. And what that list tells you is the virus is still everywhere, and it can still spread everywhere. So let's make sure we're following the best practices we can to stop the spread or to identify it and prevent it from spreading further. That's what our testing and tracking is all about. Ethnicity and race of total cases. On race, 74% white, 14.7% black or African American, 5.8% Asian, 5.25% multiracial. Ethnicity is 85.89% non-Hispanic and 14.11% Hispanic. And on the deaths, today's numbers are 77.3% white, 18.97% black or African American, 2.01% Asian, and 1.72% multiracial. Virus continues to hit our long-term care facilities. Today, we have an additional 39 residents that have tested positive, 27 staff, and there are 6 additional deaths that are attributable to residents, all residents in long-term care facilities. Remember that we are in the midst of an effort to test everyone in one of these facilities. We're doing 3,000 plus this week. When you look at today's numbers, knowing that we're doing that, it does appear that the growth in long-term facilities is overall from where we thought it'd be, probably slowing at the moment. But the staff members, again, because we're testing more and more, that number's rising a little bit faster. And I think all across the country, we're finding out that there's a lot of asymptomatic staff members in these facilities. There's one additional facility that has at least one positive case that is out there. All right, updates for today. First, Healthy at Work. We've been able to add some additional openings to the calendar. So on June 1, we've been able to add auctions. Got a lot of questions about all different types of auctions. Those openings will be on June the 1st. In a minute, Secretary Friedlander is going to come up here and talk about child care. We are going to have a portion of child care that can now open on June the 8th, with the rest of it opening on June the 15th. Horse shows, which I was asked about yesterday, also can open on June the 8th. And then for the first time, we're announcing that this is kind of coming in and out, on June the 29th, that is our target date for groups of 50 or less and openings of bars. So that is a new update based on what the numbers that we're seeing right now that we think will be responsible and that we can hit it at that time. It all depends on how good we do at being healthy at work. But we want to give people those dates to see and to work towards, and I think it relieves a lot of anxiety. So I know many questions have been out there about child care, something that we in this administration are committed to, something that's been really hard during this epidemic. So Secretary Friedlander is going to talk about the guidance that's going up online today, the timing, the help that the administration has provided, and then he's going to talk about pandemic SNAP benefits and how we're going to be able to provide some extra help to people.
Thank you, Governor. Today is a day, I think, of really good news for many people. We have been talking about childcare for a while. We've talked about what we've tried to do to help childcare during these difficult times, because childcare is one of the areas that we know is critical to opening the economy, is critical to parents, has been critical to our essential workers. We opened some limited duration centers, and since the beginning of March, we have put out to child care providers almost $62 million worth of payments. And the reason we do that is because we have child care deserts, we know we have places of need, and we really can't afford to lose many or any providers. And so today we're going to talk about opening, and that's always a balance between protecting ourselves, our families, and being able to go back and be healthy at work. So on June 8th, the governor talked about we're going to open up what are essentially the small in-home providers. Those are the providers that take care of 10 children or less, primarily more in a family-style atmosphere, and we are going to ask for them and allow them to have the opportunity to open on June 8th in accordance with the guidance that I'm going to talk about in just a moment. Then our larger center-based providers, we are going to ask them to open on June 15th. And these are our larger providers. And again, we're going to provide some guidance for them in addition to their regulatory requirements. So an overview of those additional requirements. So what we're going to ask is that as groups go out to the playgrounds and play together, that we stagger those groups. We're also, of course, going to ask for temperature checks and wellness checks on entry for everyone. We're going to ask that some of the family events that have normally happened in the centers not happen for now. We're going to ask that centers eliminate the field trips that they would be going on, again, just to make sure that they are, and the children are all within one center and not going from one group to another. And then, as some centers already do, but we're going to ask for a centralized pickup and drop-off for child care centers. Now, the main things that we're going to ask is that any group of children, any room that children are in, that it be 10 or less children in a group. And that those groups stay together all day, and that the staff that are working with those groups stay with those groups, so that we can, again, think about it, just limit, like within a cell, of the exposure that people have and children have and staff have within childcare. The other thing that we're going to ask, of course, adults need to wear masks, and children, age appropriate, should wear masks as well. We've given guidance about children under 2, but within facilities, we're going to ask that children under 5 not be required to wear masks, and that it's a judgment call on a child's developmental ability and making sure that you're making the right call on safety for that particular child. So as children are able, they should wear masks. And these guidelines will be up at 5 o'clock on the website. These and some additional guidelines. So we're asking centers to read those, let us know when we have questions. We've had a group of folks across the cabinet and working with the University of Kentucky to work on these guidelines so that they can be manageable and safe and balanced so that we can begin to reopen our economy. And I think it's really good news that we are at the point where we feel like we can open up and begin to open up childcare in a responsible manner. The next piece of good news, I have 2 pieces of good news today. The next piece of good news is called Pandemic Electronic Benefits Transfer, because, you know, we in government don't like to make anything sound easy. So what this is children who would have been receiving free and reduced meals in schools will be provided, their parents will be provided some additional benefits so that they can use that to feed their children so that their children don't go hungry because they're missing meals at school. This is a federal program. It comes through the Family First Act through Congress. It's an additional $163 million to the state of Kentucky. And so how this will work is if someone is already eligible for SNAP or TANF or Medicaid, those folks who are already eligible for those programs through the Cabinet for Health and Family Services will have this benefit added to their benefits. If you already have a SNAP card, it will just get added to your card. If you have an EBT card from the Cabinet, it will automatically get put on that card. If you don't have one of those cards, but you're in our programs, like you're in a Medicaid program, a card is going to be mailed to you. Now, some folks who get free and reduced meals or attend a school that has free and reduced meals for everyone in that school, you can also apply for this benefit. Now I have to put on my glasses. So, on the 23rd of June, you can start to apply for benefits. And those benefits are the same way you would apply through Benefind. There's benefind.ky.gov, or call this number. We've been doing great with our phones, so we've been answering in less than 10 seconds, so don't be afraid to call. And if you call, we can get these things activated for you sometime between June 1st and June 30th. This will help you buy groceries, and this will provide the food assistance that your child might be missing in schools. And so SNAP benefits, and we talk about this, and we talk about individual benefits to families and children. Also know this, like I talked about with Medicaid, when you apply for Medicaid, you are actually supporting the health system of Kentucky. When you apply for these benefits, it's not just you as the individual that benefits from that. It's your grocers, it's your local businesses, it's the entire food system in Kentucky that benefits farmers. You can use some of these benefits at the farmers market. So this is a way to help Kentucky farmers and Kentucky grocers function in Kentucky and function when we are having a time where people's incomes are reduced. And so this is a way to support your local businesses. So don't feel like this is something that is selfish or you shouldn't do or anything like that. This is a program designed to help people. This is a program designed to help people get the food they need. And as a benefit to your community, this is a program that helps your local grocer and your local farmer. So don't be shy. Please sign up for these programs. And now we will bring up Dr. Stack. And the governor says, why do we wear a mask? I wear a mask because Dr. Stack tells me to. Thank you.
Thank you, Secretary Freelander, and good evening, everyone. I have three things I want to share with you tonight. The first is the governor's asked me to explain the relationship between when we report deaths and when we report the new cases. I have to give you a general concept here because some of this, it's hard. It depends on your specific population and how you're reporting the data. But the deaths are going to lag or come after when someone gets ill, obviously. So in Kentucky, for the data that I have available, I can say that on average it's about 13 days from the time you get sick if you're going to succumb or die from this illness that you die. And so when we have data and we see that our numbers were higher a couple weeks ago, our daily case rates were a bit higher and now they're going down, which is a good thing. Someone would say, well, then why are the deaths going up? And that's because the people who got sick 2 weeks ago are now in the most severe part of their illness, where either they'll recover or they'll unfortunately die as a result of the illness. And so the deaths will peak later than the onset, than the disease, if we are getting the disease under control and the number of new patients is going down. So I hope that helps a little bit for why those two numbers may be seem inconsistent with each other, but it actually makes sense logically. The second thing is to say thank you, as the governor does and I do. We have outreach, and the secretary does, with all sorts of different elements within our community. I spoke with the leadership for the Kentucky Dental Association last night, the local health departments again today on one of our regular calls, and the university presidents across the state today. And we have colleagues across government speaking with audiences all the time. I know the governor has a busy schedule as well. We are working as hard as we can to try to make sense out of these complicated times and try to bring clarity, even though we know that these rules are complex at times. It's difficult trying to navigate them, and that's why we try to work with everyone, but also to share the basic principles about the importance of social distancing more than 6 feet, wearing masks when you're in public and can't maintain social distancing as reliably, and the hand hygiene and covering your cough and your sneeze. All those things are important regardless of the setting. And many of these guidelines that are industry specific or situation or business specific are the attempts to tailor it to those environments so we address the unique variations in those settings. And the third thing is, because I often have a call with my state health official colleagues on Friday afternoons if I don't see you before the holiday weekend, I hope you have a wonderful holiday weekend. Please remember to stay healthy and to follow the guidelines for gatherings of people less than 10. Those are very, very important. I can't emphasize enough, this disease is still very deadly. It's very dangerous. We've had great success here in Kentucky. We've done a wonderful job coming together and showing our care and our concern for each other in Kentucky and following these guidelines. That's why we're here today, able to tell you we have the opportunity to try to reopen. Some of the online websites even show that Kentucky is doing very well. I think you should feel very proud about us coming together as a team. But the work's not over, and if we take our eye off the ball, we're going to find that we have in June or July the very problem we've averted so far. So I thank you for your continued attention to these things, and if I don't see you tomorrow, I hope you have a wonderful Memorial Day, and if I'm back here tomorrow, it's because there was more to talk about. So thank you very much. Thanks, Governor.
All right, just two other small updates. The guidance is now up for both childcare and bowling alleys. We have all the guidance up for everything that starts before June 1st. We have a little bit of guidance to get up for some of the activities on June 1st. My hope is that that will be up very soon. And we're committed to try to get up the youth sports guidance by the end of the day tomorrow, because we know there are some leagues that have to pre-plan, and parents really need to look at it too to determine whether or not that they want to allow their kids to participate in those activities. So with that, we will open it up well, before that, real quick, testing. Just want to continue to let people know that there are now testing locations. There are now far more than 50. I think we had a count the other day, and it changes by the day, of 70 plus locations where you can get a COVID test around the Commonwealth. To be as safe as we can be and reopen in Kentucky, we need to make sure that people are taking tests and taking them regularly. I had a test just yesterday, and making sure that I'm regularly tested. We need to make sure that you all get those too. Got the result back today. It was negative. Most of my staff has been tested. With people coming back, they have all tested negative. But it's important that we make sure that we are getting a good portion of our population through this testing. As we are finishing up in several areas of our drive-through testing today, we've had again, some good numbers of testing in Louisville. Richmond has gone pretty well. Ohio County and Grays County, we could have done more, but it's important that we got there. And for the regions, I think we did a significant number of tests. I expect that once again we'll do over 4,000 tests just through the Kroger sites. But as you can see from yesterday to today, we're doing multi-thousands of tests now every day. It's just the reporting sometimes comes in depending on when the labs are done on different days. Again, where we are right now on this versus where we were a couple months ago is a special story of how Kentucky has come together and overcome some adversity. So today we've got Stu Johnson, Daniel DeRochers, Lawrence Smith and Philip Bailey, as well as a number of questions that have been submitted. So Daniel, we'll start with you.
So with the bars and groups of 50 people being able to open June 29th, right now with the groups of 10, you still have to keep your social distance, you still have to wear your mask. Does that mean that smaller groups will be able to gather without those kind of special precautions by then? What would that look like in terms of groups smaller than 50? So
the question is about groups of 50 or less and bars. It's going to still require social distancing, but it means you can have more people in a general area with the groups of family units separated by a little bit more. So if you think about different events that you could do with 50 and less, you could do some weddings that right now people are struggling with. You'd still want the family units spread out a little bit, but until we know that this virus, that something different is happening, the 6 feet is going to be really important. And so we're really going to have to look at and adjust the way we go about a lot of things. It's hard to think about 50 people being together and being socially distanced, but we're starting to see it in different ways. It's going to require some creativity, but I don't think we would have ever thought about the lines that are outside of some stores and how we're doing them right now. And we're going to get to see a little over a week, depending to 2 weeks, about how some other states are doing it and take the best practices from that. Gyms in Ohio can now reopen after a judge ruled against the state's order keeping them closed. I think that judgment's going to be appealed. I haven't talked to Mike DeWine about it. That is a state court judge, and I only got to read a brief part of that decision, but I would be surprised if that's not appealed. And I think that Governor DeWine was acting within his authority. But I also know that he is working on guidance for gyms. We can't go back, and this isn't just about gyms. We can't go back right now to everything the way that we used to do it. Why? Because we know we've got an aggressive virus out there. That's why I've been very appreciative of the vast, vast, vast majority of Kentuckians that know that we got to do this gradually and that want the guidance. They're actually supplying a lot of the information that becomes the guidance. And I got to tell you, you look at retail opening this week, I'm really proud of our retail facilities. And I think we're going to see the same thing from restaurants, of being really thoughtful on how we do things. I saw, Lawrence, this may have been on your station, some reporting on a store that sells musical instruments. And there are some things there in retail that we'd never thought of, but they had thought about what happens when someone wants to try to play something and what needs to be done to clean it before the next person that comes in. We got people really trying and really working. And if we continue to see those trends, I think we're going to do a very good job in how we're reopening in Kentucky. So with that, Lawrence.
How does the daycare guidelines apply to churches and other houses of worship?
That's a good question on how the daycare guidelines apply to churches and houses of worship. If they are so churches do a couple different things. If they are operating a daycare or a Mother's Day out, Secretary Freelander, they fall within those guidelines, don't they? Well, let's ask Secretary Freelander to come up and give you the right answer.
You were on your way. So we would ask them to follow those guidelines. They're fairly simple. It's really about making sure that people that come in are checked and screened for illness, that you wear masks as appropriate, and particularly like in a church, that you abide by those CDC socially distancing guidelines. So yes, particularly those then are providing daycare, then you have to.
So on a Sunday morning, it would apply as well, the same rules?
Yes. Yes, we would want you to follow those guidelines, yes.
And in many ways, it'd be really important for those guidelines to be followed because they extend the contacts, the service, the Sunday school, or sometimes you get to drop your kids off to go to the service, which I remember was really nice when we had two very young children, but it makes everybody safer through it. So our houses of worship have been really incredible about wanting to do the right things. They have been leaders throughout this, really important leaders in flattening the curve. And what we see right now through our houses of worship and the steps they're taking, and some that realize they're not ready to open. Those have been, it's been really special to watch how Kentuckians have responded. Okay, we answered the, is it true that hospitals are paid more in Medicare or Medicaid if their patient's diagnosis is COVID-19, and paid more if on a ventilator? What safeguards are in place to make sure they're not inflating numbers just to get more money? I'm going to let Dr. Stack respond to that one.
So the question is if hospitals are paid more for patients with coronavirus and if they're paid more if people are on a ventilator and in an ICU. And so the payment rates are already established. And so Medicare and Medicaid and private commercial insurers already have rates that are either set globally or that are negotiated as part of a contract. And I don't think those rates have changed. What has changed, however, is that patient out-of-pocket obligations, so copays, deductibles, and things of that nature, have, in large measure, not absolutely, but in large measure, have been waived for Medicare patients or Medicaid patients, or which normally they wouldn't pay it anyway, or commercial insurers. I think even in cases the federal government through the CARES Act tried to make it that patients did not have a substantial out-of-pocket burden for COVID-related treatment. So the specifics depend on your insurance that very specifically. As to the question about whether people are inflating things, I have no sense that that's occurring. The hospitals are out there trying to take care of patients and struggling just like everybody else to kind of feel their way through how we do this efficiently and effectively. But I don't have any inclination, and I have not heard anything to suggest that anyone is trying to take advantage in the hospital setting of patients for providing care for sick people with coronavirus. So thank you. And I think the Secretary has more to add.
And just a little more to add. That's the job of the the auditors, the Inspector General's office, the Medicare auditors, they will review once we're through all of this. So I feel very confident as with Dr. Stack. We haven't seen any of that. We've seen hospital systems and hospitals and healthcare providers who've been trying to work with us. So I feel very good about their cooperation with us as we've gone through this.
All right, Stu?
Question, Governor. Secretary Freelander mentioned the 1 to 10 grouping with the 1 adult and the 10 children throughout the day. How will that affect capacity and for how long?
Well, let the Secretary answer.
Enough. It will affect capacity, right? That's part of it. We don't have a limit on capacity, but when you limit to 10 in a group and you say that that's the same group and you say you have the same staff that are working with that group, there will be a natural limit on capacity. Now, I can't define what that number is. We know that by these requirements, we are putting some limits on capacity. It's just there's no specific number or percentage that I can give you. Well, till we get out of the emergency, until we get into a better place.
And I think what I'd add on that is it's like everything else. As we get better control, as we are testing and tracing is helping us to preclude the spread or outbreaks, then we want to increase everybody's capacity as we move forward. But let's also be transparent and honest with people that until there's a vaccine and effective treatment or something that we don't foresee happens with this virus, we're not going to be at the same 100% capacity that we were before. Our world until that point has to be based on reduced contacts, a little bit more moderation. Several parents have asked if we'd reiterate the guidelines for teenagers who they say are having spirited discussions on whether they can at least hold hands or give a quick hug to their boyfriends or girlfriends when they see them tomorrow. Oh my goodness. I think what I want to say is what I say to my 9-year-old daughter, and that's that you can date when you're 30. But listen, we're realistic. We know that people have missed each other. We're going to ask that you stay 6 feet apart, which is what we need to do for public health. But do your best, limit your contact as much as you can, and it's the best advice I can give you. And again, wait until you're 30 to date. Phil.
Governor, Senator McConnell made it clear on a conference call with House Republicans this week that he will end, or wants to end, boosted unemployment benefits. Are you concerned at all about government benefits, the extra $600 outpacing private wages, and that will stall the economy restarting?
The question is about the extra $600. Senator McConnell apparently said today on, was it a private call, a conference call, one or the other, that he was for ending that in the belief that people might not go back to work because of the amount. I think we're going to have plenty of people ready to go back to work. What I want to make sure is that people who need help are getting help, and we're working so hard just to make sure everybody who needs help gets help at a time when we have more claims than ever before. I'm not for cutting the benefits that they are getting at this time. And we are still, every state is just at the start of reopening. Now, they could be at different levels, they could have a different plan, but nobody has been doing this for more than a couple weeks or 3 weeks at most. And let's make sure that we see where things are going with this virus and not draw lines in the sand that could be harmful to our people. I hope that our reopenings all across the country, even those that are being more aggressive and taking more risks, are successful. But we are up against a significant adversary, and I think we've got to be humble to know that we've got to watch, we've got to be fluid, we've got to be flexible. And some of the fights in D.C. where people seem to want to just draw a line in the sand for whatever reason, I don't think are helpful to what we're trying to do. What data points are we looking at making decisions about reopening? We have total number of cases. We have the infection rate, the percentage of positives in the total number of cases. We also look at our total capacity to test. We look at the percentages in the general population versus the more targeted that we test. We look at the number hospitalized. We look at the ICU numbers. We look at different modeling, a lot of which you can see online, the COVID Act Now, and even the reopening strategy and the 91, the COVID-19 backwards. We look at just about everything that's available to us. And I can't say that there's just one that says this is where you need to be. But most of the time, looking at all that data, you get a good idea, number one, where the direction is going. And right now, I believe we have either plateaued or we're decreasing. When we look at our positivity rate, it looks like Healthy at Home has worked. Well, we know it's worked for saving lives, but right now we believe that we certainly see a decrease in the rates, the positive rates, and so we feel like cases are moving in the right direction. But that's based on when we were healthy at home. And so we've got to watch moving forward what Healthy at Work does. We want to make sure that it certainly doesn't increase from our plateau. Tell us more about the issue regarding reporting on ICU data. We talked about this. Now that's coming directly from hospitals. So as long as hospitals are inputting that correctly every day, that ought to be an accurate number moving forward. But again, it relies on lots of people putting information into a system that comes to us. Have we discovered any other discrepancies in data, particularly those currently hospitalized? We're getting that rate now from the exact same group, but we're always a little bit worried about the data because it comes from so many places. I still worry we don't get the total number of tests being done. Of all the data, I think the number of negative tests that we don't get back are significant. It's hard to say what it is because typically under the law with other things, you only have to report positives. Now it's really important that we get negatives. And there are new testing companies every day. I was looking through our new line list of cases, and there are some that I'd never seen before, and that requires outreach. That requires getting them in the system and reporting on a once in every 100-year pandemic. I don't think that there's any public health department, and they all do a great job, that was ready for that type of reporting in real time on a daily basis. But it's one of those lessons we're going to take out of this. And when our data hasn't been as accurate as it should be, we're going to admit it, and we're going to do better. Daniel.
So the state hasn't processed any pandemic unemployment assistance claims since April 25th, and that number has been relatively low. That's for like contractors, freelancers, part-time people. What's going on there? I mean, is it being grouped wrong, categorized wrong?
I'm going to need to get you a direct report on that from Josh Benton. I do believe that the federal government has asked for additional steps to be taken when it comes to the pandemic unemployment insurance, but I want to get you something accurate, which I don't have for you at the moment. Lawrence.
Still getting pushed back in my inbox to your stance on the swimming pools.
Yeah.
Why are you so convinced this can't be done safely, and should there be a distinction between larger public pools and neighborhood community pools?
So the question is on swimming pools, and you know, a lot of the stances on swimming pools are based on this fact that it can't be spread in the water. Well, everybody isn't in the pool 6 feet apart all of the time when they're at a pool. That's not what that experience is like. What we know, and we've had a number of health experts weigh in on it, is it's outside the pool, it's people above the water. It's a difficulty in social distancing. Now, we have provided guidance, and there can be openings for exercise, for laps, and certainly for people training. When we talk about youth sports, there's going to be an ability to do swim teams as long as they can monitor them, and a lot of it's going to be about parents, just like at baseball games, where the biggest concern is parents being too close to each other. And when we hit 50 or less, that may create an opportunity to do something with pools, and we'll look at that. Those would be community-based pools. Again, most parts of the country are not going to open public pools where it's really hard, and it's really tough to ask a lifeguard to be able to police social distancing in and out of a pool while at the same time protect people's lives who would be in it. But we understand that there are many people who want a normal summer, and I wish we could have it. It's not going to be a normal summer for my kids. My son would be at a bunch of basketball camps otherwise, and it's just going to be different. But again, our goals, we got to know what our priorities are. Our two priorities are to make healthy at work successful, to get our economy up and running and not have to pause it. And my number two goal is to get kids back in school this fall. And so a lot of the decisions are based on risk to those two goals. And so one question would be, we really want to get back in a pool, but if we did it on a wider scale, and I told you that would increase the risk to healthy at work or to get back in school by a certain percentage, would you want to do it? And I think most people would say no. Stu?
Talked about this week about working with the Louisville Zoo and also Kentucky Kingdom. What about indoor recreational entertainment facilities?
It's a good question. Indoor recreational facilities, there are a lot of those, and my kids have enjoyed them. Based on the amount of things to touch and capacity, it's just taken us a little longer on those. We want to make sure that those facilities are as safe as they can be. And the other challenge is they're very different, right? You can have very different indoor entertainment facilities. So we just want to make sure we're doing it right. But again, when we hit the 50 or less, there's going to be an opportunity for a lot more types of facilities to open up, because it creates a much easier standard where you can have a certain capacity that you can then monitor for social distancing. I do want to, the president's come down hard on states' use of mail-in ballots, or am I feeling a pressure to find another way to vote? We're set for the primary. It was a bipartisan agreement between myself and the Secretary of State. I applaud him for his willingness to do that in the primary. I guess we'll see about the general after that. I believe tomorrow the portal will go live for absentee ballots. And as long as that's the case, I'm going to talk about it at 5 every single day, because the absentee ballot, it will be the safest way to vote here in June. And we want people to vote. I believe in people voting, and we got to make sure that we get it done. Phil.
Governor, piggybacking on that, Representative Jason Nemus and Representative Atticus Scott penned a letter together expressing their concern about Louisville, Jefferson County only having one polling location, that being the fairgrounds. Both of them expressed, obviously they come from different political spectrums about voter suppression potentially. What do you think about that? Is there an idea, or should there be an open conversation about maybe a second alternative site for Jefferson County?
The question is on one polling location at Jefferson County, and should there be an open conversation about having more? I mean, something as fundamental as voting, I think there's always going to need to be an open conversation. I wasn't a part of that decision. I would like to see more locations. I am told that there is a challenge in how many different ballots Jefferson County has and how that could be done. So I want to recognize the challenge. While I still tell you my preference would be to have multiple, but the governor isn't directly involved in that. My goal, what you'll see me doing, is trying to get as many people to vote by absentee ballot as possible. And admittedly, that is more challenging on some, but that's why the postcards are going to go out. That's why we're going to talk about it every day. And I hope, and we'll really see, I mean, this will give us really good information about what having everybody be able to do an absentee ballot by mail can do to turnout. Typically low in a primary. And so this will be, my hope is that we see maybe more turnout based on that. Now we'll be able to analyze, based on the number of locations we have, what impact that had as well. And I think everybody's trying. I mean, we're in the middle of a pandemic. We're worried about poll workers. We're worried about people coming in. We're also really worried about access to the polls. It's just not it's not an easy situation with any right answer. And I appreciate everybody pushing, having the discussion, trying to advocate for what they think is right. We're still hearing about professionals getting just one N95 mask a week. So that's the area of PPE that is still a challenge. But if you'll put up the Battelle slide, we can clean those N95 masks so that they can be used longer, and you would be able to switch them out faster. This is, again, an opportunity to make sure that we can get those masks cleaned and get them back out to people. All right, I'll do a very quick lightning round. Daniel.
So there are a couple of bars and places in Lexington that seem to be doing live music or have live music scheduled for this weekend. Is that okay? Is that allowed?
As long as a bar or a restaurant is following all the guidelines that they need to, that people are distanced, that they've met the capacity, that the tables are spread out, sure, they can have live music. That doesn't put anybody at any more risk. Since you're singing, you're spraying, you just need to be far enough away and ensuring that that doesn't harm people. But yes, that'd be great. Lawrence.
The CDC is now saying that the virus is not easily spread on surfaces. Does that affect your thinking on how you proceed from here, or how should people take that advice from the CDC?
Yeah, the CDC has now come out and said it doesn't spread on surfaces as easily. That's good news. We've always focused on droplets from the mouth. That's primarily why you want to stay that many feet apart. But we'll read that and we'll continue to consider it. But certainly the cleaning is still really important for a number of reasons, and people shouldn't be lulled into a false security because if the CDC is right on spread through touch, it was still escalating at one point and dangerously escalated in many places across the country without it. So while it's good information, I want to make sure that we're still using those best practices. And if that's the case and it's spread like it's spread, the mask is even more important because it says that that is the origin, your mouth and those droplets of so much of the spread that we've seen. Also suggests the mask could be that much more effective in keeping it from spreading. Stu?
Outdoor seating for restaurants, Lexington, there's plans to be sidewalks and streets and outdoor classes at colleges. So how much lower is the risk of transmission found outdoors compared to indoors?
So the question is, how much less is the risk outdoors versus indoors of transmission? And the answer is nobody has a specific number on that. But we believe that it is less risky, that it is optimal to be outdoors. It allows for you to spread out much easier, and it also disperses, the methods of which it would transmit, especially if touching a surface is less of a risk of it transmitting. We want to encourage people to be outdoors, to do things outdoors, and this Memorial Day weekend, get together with people outdoors. All right, bring us home.
Governor, do you think, given the disproportionate number of cases and deaths, particularly in nursing homes, did your administration, do you take any responsibility for your administration doing enough to protect those nursing homes amid this COVID-19 pandemic?
Question is about nursing homes and a huge percentage of both our deaths and infections being there. Did we do enough? I believe we did everything in our power with the resources we had. We did one of the first visitor bans in the country. And remember, this thing has to be transmitted in some way. We've been some of the earliest to do widespread testing, and we were doing that early on. We've been one of the first to do full evacuations of floors with Trayton Oaks, and one of the first to provide different teams that would come in and entire hospital systems behind them to provide PPE directly from the administration. This has been really aggressive in those areas. And I don't begrudge anybody that is scared or frustrated because of it. This was an entirely new virus. And again, if we dealt with it before, which nobody had, looking back, would we do things differently and at a different time? Sure. But with the resources we had, I think we acted in the best way we could every day. I think we'll look back on all of this and we'll see that we had as Kentuckians, as Americans, one of the best responses to a pandemic in human history. But with what we learned, by the end of it, we'd absolutely go back and make different decisions at different times from what we learn about how the virus spreads. But what I can say is we've made the very best ones based on the data in front of us and what we've known at the time. All right, tomorrow we'll again do this at 5. Then I will provide an update on Saturday via a press release or a video. And then we'll be off Sunday and Monday because labs and testing will be closed. And we'll be back on Tuesday up in the Supreme Court chamber, one of the most beautiful buildings in this Capitol. We have a pretty special ending tonight. Again, it's finding ways to get together and to play music together, especially with those we go to school with. This is Highlands Fort Thomas. We'll see you at 5 o'clock tomorrow.